Hello, and welcome to this podcast on alternative and complementary therapies. These are the different kinds of treatments that are often used outside of the mainstream treatments within the NHS. Before we begin, let's just define what we mean by alternative and complementary therapies. Whenever anybody mentioned the words alternative therapies to me, I had a preconception that these were wishy-washy things that wouldn't actually help people. But the more I've learned about these treatments, the more I've realised just how wrong that judgment was. These are hugely beneficial for millions of people and shouldn't be something that is so easily dismissed. So, before we get into the different types of therapies, their potential benefits, and how to access them, let me explain a little bit more about the difference between mainstream treatments and alternative and complementary therapies. The main difference is that the organisations that decide what is mainstream and what is not, like the National Institute of Health and Care Excellence, say that there isn't much scientific evidence to justify rolling these alternative therapies out across the country. It doesn't mean that the 10,994,785 people that received alternative therapies in 2021 in the UK did not find them beneficial. What's important here is recognising that we are all different, so it's good to see what will work best for you. The recommendation from these governing organisations is to use these alternative therapies alongside the mainstream ones. In other words, use them as a complementary therapy rather than an alternative one. They would also recommend that you check with your GP before signing up to any therapies, especially if you're taking another medication or using other treatments, you're pregnant or breastfeeding, or you're under the age of 18. Overall, these therapies are simply different approaches to achieving the same goal, to help you improve your physical, mental, and spiritual well-being. People try them out for loads of different reasons. They might not want the treatment the doctor is offering, such as medication. They might have already tried all the other different types of treatment, but they didn't work out. There could be a long waiting list, so you simply want to try other options while you wait for a mainstream one. Whatever the reason, ensure that you are safe. Ideally, the practitioner is regulated or registered with the CNHC or the Therapies Professional Association. So that's the boring stuff out the way. Let's talk about some of the most common types of these alternative or complementary therapies. The first one we'll chat about is hypnotherapy. If you are like me, when you hear hypnotherapy, you think of a performer at a circus standing on a stage and hypnotising someone to perform a trick. But in reality, hypnotherapy is very different. It is a recognised clinical practice that dates back to the 18th century. It is the process by which a practitioner would help you enter a natural psychological state of heightened concentration, calmly focusing your attention on a specific mental or physical sensation or task. The idea is that once you've entered this hypnotic state, where you are conscious, alert, and absorbed in what you are thinking or doing, that you can ignore everything else that's going on and work more effectively to achieve your goals that you and your practitioner have curated. In a clinical setting, hypnosis is performed in a controlled and structured way. Once a hypnotherapist learns your specific goals, they will help you enter that psychological state. Then they will give you specific suggestions to facilitate the changes necessary for achieving your goals. It is also a great way to access your unconscious and subconscious thoughts. These are the thoughts, emotions, and instinctual reactions our brain has suppressed or does automatically. This is why hypnotherapy is effective for understanding the causation of anxiety and depression for a lot of people. It does this by utilising clinically proven techniques like imagery, which is when you try and picture the physical or mental feelings in a previous or future event. Practitioners believe that this process is very effective at handling your problems independently. It creates new pathways in the brain, meaning that we can develop better ways of thinking about things faster than if we weren't in this hypnotic state. In the same way that you can learn a new dance move quicker if you feel more confident and focused while learning it. Practitioners will also often set homework to practice self-help hypnosis and meditation to reinforce the suggestions that you've been accepting during your clinical sessions. So what does it feel like to be in that psychological state? Well, the most common sensations that people experience are relaxation, physical comfort, empowerment, the absence of distraction and negative self-talk, enhanced imagination, better memory recall, and a sense of complete control. Suppose this sounds interesting to you and you would like to join the 6.3% of the country that has tried hypnotherapy. In that case, I would recommend you doing more research on this therapy, but here are some basics to help guide that research. Price-wise, on average, in the UK, a hypnotherapy session costs around £50 per hour. You can find hypnotherapists through the National Hypnotherapy Society and the Complementary Healthcare Council, and it is not advised for an individual experiencing psychosis or certain types of personality disorders to participate in this therapy. And as always, it's probably a good idea to check with your GP before signing up to it. Mindfulness is the next alternative therapy that we're going to be talking about. Mindfulness has massive support for the NHS for treating depression and anxiety. They describe incorporating mindfulness into their therapies as a significant step forward in the effectiveness of the programmes for mental health, a step forward that has been recognised and copied internationally. Mindfulness is estimated to be used by 10,300,000 adults in the UK alone, many of which do not have any mental health conditions. It can be done in many different ways, using many different techniques, making it so good for many different people. You can mess around with it and find which style works best for you. There's mindfulness meditation, breathing exercises, visualization, body scanning, journaling, and sensory activities, just to name a few. These all come under the umbrella term of mindfulness because all that mindfulness actually means is that a state of mind you achieve when you focus your attention on the present moment while accepting your thoughts, feelings, and bodily sensations. A crucial part of this is that acceptance. People tend to overanalyze everything, especially when they have depression or anxiety. So this helps to slow things down and allows you to acknowledge your worries, irritations, and painful memories rather than constantly just battling against them. A lot of research has been done to see how effective mindfulness is for depression and anxiety. This research indicated that it is effective for around 40% of people with depression. Some studies have even suggested that mindfulness is as effective at preventing relapse for mild depression as medication once it has been practiced for 8 weeks. Research has also indicated that mindful meditation is particularly effective for anxiety. However, all these different types of mindfulness take work, practice, and personal effort. At first, people may struggle and get distracted too much to get any benefit out of it. Mindfulness is a skill that takes practice, but is a skill that you can learn quickly if you are patient with it. It doesn't work for everybody though. Sometimes becoming more aware can increase your personal frustration or your judgment, worsening your depression or anxiety. Just like all therapies, it doesn't always help. If you want to start practicing mindfulness though, there are lots of resources for free online, or you can access new mindfulness-based cognitive therapies that the NHS is rolling out. Acupuncture is another really old alternative therapy. It was first used in China approximately 3,000 years ago to relieve pain and cure diseases. The treatment involves the insertion of very fine needles in specific parts of your body. These points are selected because they are believed to correct the flow of blood, bodily fluids, and qi, which is an energy. This practice also has newer variations such as moxibustion, electroacupuncture, cupping, and ear acupuncture. If you would like more information about any of these, the British Acupuncture Council is a great place to look. There has been little clinical research into how effective acupuncture is for depression and anxiety, but there are lots of small studies showing that the symptoms of depression and anxiety improve significantly for a short period of time post-treatment. However, all the research agrees that acupuncture does not address the underlying causes of depression and anxiety. Currently, the NHS and NICE recommend acupuncture for the treatment of headaches and treatment of chronic pain. This shows that it's pretty safe and recognised scientifically to actually help people. Suppose you're experiencing depression or anxiety and have headaches or chronic pains. In that case, this could be a good fit for you. But as always, it's best to check with your GP first. If you wanted to find an acupuncturist, you could find registered ones using the British Acupuncture Council or the Complementary Healthcare Council's website. The next alternative therapy that we're going to be talking about is aromatherapy. This is another different type of way to improve your depression or anxiety. It is used within various settings from health spas to hospitals to treat multiple conditions. In general, it is believed to relieve pain, improve mood, and promote relaxation. It does this by stimulating your sense of smell and skin absorption. And it uses loads of different ways to do it, including diffusers, inhalers, bathing salts, bodily oils, creams or lotions for massages, facial steamers, hot or cold compresses, and face masks. These methods are often used by individuals suffering from depression or anxiety for various different reasons. For example, improving sleep quality, treating headaches, improving digestion, boosting immunity, and reducing stress. A cool study was recently conducted whereby they investigated if stimulating one of your senses had any impact on depression. They found that merely introducing citrus fragrances had a significant impact. The participants experienced a reduction in their depressive symptoms, meaning they could receive a lower dose of antidepressants with no adverse effects. If you want more information or want to see a specialist aromatherapist, you can seek guidance from the Aromatherapy Trade Council or the NHS website. Each product that you use has its own chemical makeup, reason for use, and potential risk. Hence, it is important to speak with a trained aromatherapist, GP, or pharmacist before applying or using any oils for healing purposes. The next alternative therapy that we're going to be talking about are massages. Massages used to be only available in luxury spas and upscale health clubs. Today, massage therapy is offered in businesses, clinics, gyms, hospitals, and even airports. Massages have lots of possible health benefits, but before we get into those, let's define what it actually is. Massage is a general term for pressing, rubbing, and manipulation of your own skin, muscles, tendons, and ligaments. Massages may range from light stroking to deep pressure, and there are many different types of massages, including these common types. Swedish massages is a gentle type of massage that uses long strokes that are kneading, deep, and circular. It also uses vibrations and tapping, and they can help you feel relaxed and energized. Deep tissue massages is a massage that uses slower, more forceful strokes to target deeper layers of muscle and connective tissue, and it is commonly used to help muscle damage from injuries. Sports massage is like a Swedish massage, but generally geared to people involved with sports activities to help them prevent or treat injuries. Trigger point massages is a massage that's focused on an area of tight muscular fibres that can form in your muscles after injuries or overuse or prolonged anxiety. You can also get massages for specific parts of your body or the whole thing. A massage is generally considered to be part of an integrative medicine. It's increasingly being offered alongside standard treatment for various medical conditions and situations because of its clinically proven benefits. These can include reducing stress and increasing relaxation, reducing pain and muscular soreness and tension, improving circulation, energy and alertness, lowering heart rate and blood pressure, and improving immune function. While more research is needed to confirm the benefits of massages, some studies have shown that massages can be helpful for anxiety, digestive disorders, fibromyalgia, headaches, insomnia, injuries. But beyond this, the benefits for specific conditions or diseases, some people actually enjoy going for a massage because it produces feelings of caring, comfort, and connection. But despite its benefits, massages isn't meant to be a replacement for regular medical care. Let your doctor know if you're trying massages, or be sure to follow any standard treatment plans you have. It does also come with some risks and can be inappropriate for some people with the following: bleeding disorders or taking blood thinning medication, burns or healing wounds, deep vein thrombosis, infections, broken bones or fractures. If you suffer from any of these things, discuss the pros and cons of a massage with your doctor, especially if you're pregnant, have cancer, or are experiencing unexplained pain. Some forms of massages can leave you feeling sore the next day, but massages shouldn't ordinarily be painful or uncomfortable. If any part of your massage doesn't feel right or is painful, you can speak up right away. The most serious problems come from too much pressure being applied during a massage. Finding a registered masseuse is important. Ask your GP or someone else that you trust for a recommendation or referral. Many schemes within the NHS or the voluntary sectors provide affordable access to massages if you're worrying about costs. But when you do find a masseuse, don't be afraid to ask questions like, are you licensed, certified or registered? What is your training and experience? How many massage therapy sessions do I need? What is the cost? Or don't be afraid to talk about some sensitive stuff like not wanting to be touched in a certain area or keeping your clothes on during the therapy. But overall, brush aside any thoughts that massages are only a feel-good way to indulge yourself or pamper yourself. On the contrary, massages can be a powerful tool to help you take charge of your health and well-being. Whether you have a specific mental health condition or are just looking for another stress reliever, you can even learn to self-massage or massage with a partner at home. Meditation is another excellent form of alternative therapy that has grown massively in popularity over the last 20 years. It has shifted from a society imagining meditation as a monk sitting on top of a mountain meditating for hours every day, to an exercise for your mind for ordinary people like you and me. The idea of meditation for most people is to spend a few minutes restoring a sense of calm and peace. It is a simple and inexpensive technique that anybody can do. You might find it difficult at first. It can be tough to sit down and do nothing. This is where guided meditations can be amazing. So many people have found that this method of meditating is beneficial. So I'm going to invite you now to give it a go. There is no pressure to actually do what the lady is saying. You can just sit and listen if you want to. The audio clip that I am about to play you was used by the UCLA in a research project in 2015. They found that 87% of their participants found a reduction in their stress and anxiety and an increased self-compassion after following their guided meditations. So maybe it's worth giving it a shot. What have you got to lose?
So find a relaxed, comfortable position, seated on a chair or on the floor, on a cushion. Keep your back upright, but not too tight. Hands resting wherever they're comfortable. Tongue on the roof of your mouth or wherever it's comfortable. And you can notice your body from the inside, noticing the shape of your body, the weight, touch. And let yourself relax and become curious about your body. Seated here, the sensations of your body, the touch, the connection with the floor or the chair. Relax any areas of tightness or tension. Just breathe, soften. And now begin to tune into your breath in your body. Feeling the natural flow of breath. Don't need to do anything to your breath. Not long, not short, just natural. And notice where you feel your breath in your body. It might be in your abdomen. It may be in your chest or throat or in your nostrils. See if you can feel the sensations of breath, one breath at a time. When one breath ends, the next breath begins. Now, as you do this, you might notice that your mind may start to wander. You might start thinking about other things. If this happens, this is not a problem. It's very natural. Just notice that your mind has wandered. You can say thinking or wandering in your head softly. And then gently redirect your attention right back to the breathing. So we'll stay with this for some time in silence, just a short time. Noticing our breath, from time to time getting lost in thought and returning to our breath. See if you can be really kind to yourself in the process. And once again, you can notice your body, your whole body seated here. Let yourself relax even more deeply. And then offer yourself some appreciation for doing this practice today. Whatever that means to you. Finding a sense of ease and well-being for yourself in this day.
I hope that you found that enjoyable. But suppose that you don't find guided meditation works for you. In that case, you can try mantra meditation, mindfulness meditation, or the most common form, which is yoga. But like all these things, it doesn't work for everybody. If you have truly given it a go and don't want to try again, that's fine. There are plenty of other things that we can do. Drama and movement therapies can be a great way to express your emotions differently. These therapies work around the idea that sometimes traditional verbal therapies can be too rigid, and that this blend of verbal and non-verbal demonstrations of emotions and character can help people express themselves in new ways and provide momentary escape from their own lives as they play roles of another. A registered drama therapist could work through improvisation, puppetry, role-playing, pantomimes, mask works, and a whole host of entertaining activities that have been shown to have real-world clinical benefits. The research has shown that these type of therapies can be more effective for some individuals who have gone through trauma, both physically and psychologically, and who have had substance abuse problems. Peer groups are another great form of therapy that has become increasingly popular over the last 20 years. Most people have a preconception that a peer group is like what they see in the movies. A group of people that are sat round in a circle, and one at a time they stand up and say, "Hi, my name's Bob and I've got depression." Sometimes it is like that, but most of the time it's a lot more relaxed. Yes, it's a therapy, so it is pretty formal. The facilitator is the one who sets the tone for how formal it is, but at the end of the day, all it is a safe space to chat with people who are going through the same thing or similar things to you, to be heard and understood by people who have lived experience with mental health issues. They are also quite common. You can choose from multiple groups and organisations. There are ones for general mental health problems, or you can specialise for specific issues from miscarriages to bereavement and social anxiety. If you would like to join a peer group, have a chat with your GP, and they could have some good recommendations for ones for you. Or you could search on the internet for online or in-person peer groups. Outdoor therapy is an umbrella term for any type of psychological therapies that are delivered in nature. It is a relatively new approach that recognises that we often feel better when we're immersed in nature. It combines the benefits of being outside and the benefits of counselling. Therapy outdoors can feel less intimidating than sitting face to face in an office. It helps to give us different perspectives, to understand ourselves and explore our options for the future. There are multiple other forms of delivering this type of therapy. There is traditional therapy route, where you have a regular counselling session but outdoors in nature, or you can have sessions where you engage in nature in some way. This could be gardening, walking, crafty stuff, or exercise groups. There are so many different options that recognise the power of being engrossed in nature. Listening therapy is another alternative therapy that is relatively new. It is designed to help people get everything off their chest. Unfortunately, people with mental health problems often feel guilty about talking to others about their issues, or don't have anyone to talk to at all. This results in their thoughts and feelings building up and bubbling away in their heads, with no opportunity to let the pressure out. Listening therapy also allows them to chat about everything and anything that they are thinking about. A trained listener will be on the other side to do precisely that. Listen and give you a friendly and confidential ear. The final alternative therapy that we're going to be discussing is called Reiki. Reiki is a Japanese technique for stress reduction and relaxation. It is based on the idea that an unseen life force energy flows between us. Reiki therapy is designed to increase this energy, allowing us to be more capable of being happy and healthy. Research has indicated that individuals with depression and anxiety had no significant benefits from this therapy. Still, they also didn't have any adverse effects. However, some people have found it highly beneficial, so it remains an area requiring a lot more research. All of the therapies that we've discussed in this podcast are just some of the many different ways that you could access support. If you want to find more, talk to your GP or conduct your own research using verifiable sites. I hope that you have found this podcast interesting. Thank you for your time and for your attention, and I'll see you in the next podcast.